Hi guys, it's Jasmine again. This is in regards. I'm doing this video cardiac defects in pediatrics for JCC nursing students and for myself. Because the more I see myself teach these lectures and listen to myself, when I take the exam, it sort of aids me in remembering what the lecture was about. So now we're going to talk about bacterial endocarditis. So what is bacterial endocarditis? Bacterial endocarditis is a inflammation of your inner lining, the soft lining of your cardiac muscle, and itis is always associated with some type of infection. So it literally says smooth heart muscle infection bacteria. Okay. So what are some risk factors of why someone might get bacterial endocarditis? Let's think. Boom, I know one. Rheumatic fever, untreated strep throat is one. If they've had some type of valve damage, if they've had a prosthetic valve damage, or since it's not your valve and they put a prosthetic valve in there and it gets infected, yes. Or recent cardiac surgery. So again, let's go over this again. Why would someone get bacterial endocarditis? Rheumatic fever, uh, just forgot on that quickly. Prosthetics, some type of valvular damage, and if they've had a recent cardiac surgery. That can be due to too if they've had a cardiac cath and it's running there. I mean, that's a risk too of an infection. The main two infections are staph and strep. I just talked about. So how this occurs, you have this bacteria that enters the bloodstream and decides to stop and make their home on the mitral or the tricuspid valves. Um, um, and that's what happens. Now, dental work can cause it. Like again, I said cardiac surgery can cause it. And if you have a long time catheter use with the cardiac cath, can cause it too. So they can form microorganisms on your valves and vegetate and live there. And they can also break off and immobilize too. Uh, it's just bad for business. So, how will a child present if they have bacterial endocarditis? They're not gonna want to eat. They're gonna be tired. Um, and a telltale sign is they'll have these little red uh, petechiae on their tongues, and they'll have like splintered nails. Um, and then they'll have Jane lesions on their hands. So again, signs and symptoms of bacterial endocarditis. They'll be anorexic. They'll be tired. They'll have splintered nails. They'll have Jane lesion palms, and they'll have petechiae on their oral mucosa. So let's say the mom brings the child in, and she's like, my child's been sleeping. They've been tired. They haven't been eating, and you go and do your assessment. You start it from head to toe and you look, you go down their eyes, their nose seems fine. You open their mouth, you see these little red spots. You're like, hmm. And then you keep going down, you listen to their heart, and you're like, I hear a murmur. And then, you know, you keep looking because sometimes murmurs can be normal, but and for pediatrics, they're not. And then you look at their hands and you're like, they have these dark lines, these splinters, hemorrhaging occurring in their fingernails, right? And then you look at their fingernails and you turn them over and you see these lesions and you're like, bacterial endocarditis. Super easy. It's just do your assessment. And diagnostically, they're going to do a echo and they're going to do labs and CBCs and cultures to see what type of infection it is so it can be treated. CBC in regards to blood. How? diagnostic and treatment. The best way, like rheumatic fever, is to prevent it. Prevention is the only way to truly treat bacterial endocarditis. Just prevent it. Now, if they're having dental procedures done, you want to give them their antibiotics 1 hour prior to a dental procedure because they have some type of infection in their mouth. It can get into the bloodstream and it can just settle on their valves. Okay. Now, that's with certain antibiotics, excuse me. Antibiotics 1 hour prior to certain procedures. With dental work, you're not going to give the antibiotics before uh, if you don't know. Because if you give them the antibiotic before and you do the dental work, it's harder to pinpoint what type of bacteria that is if you give them the antibiotics before. So afterwards, you just wait and you see what's going on. You see all these signs and symptoms when they bring them in, and then you're like, then you that can better help you determine what it is. Okay. Um. So with dental work, what puts them at risk is gingivitis. I think I mentioned that in my other video. Respiratory infections and catheterization. So, uh, yeah, move on. And that's really it for bacterial endocarditis. So, I hope you guys like this video. Uh, my back just hurts. Can't keep right on this board. It's like horrible. But yeah, so bacterial endocarditis. The key is prevention. Do your assessment. Their mouth, their hands, their fingernails. Uh, they're tired and they're fatigued. And the diagnostic is treatment and prevention. That's our nursing assessment. She didn't have anything else on there in regards to what we're gonna do. All right, so guys, I hope you like my video. Bye.